About today are some DHS staff changes, as well as provide updates on the Bureau of Labor Statistics and Consumer Price Index. We'll go through some 2023 cost reporting updates and provide a compensation threshold overview. And then we'll allow some time at the end for some questions, as well as talk about future training topics. So as we get started today, we're going to ask that everybody keep their cameras off and their microphones muted. That just makes it easier for everybody presenting. And then we'll pause occasionally to allow time for questions. And if you can put those questions in the chat, that would help us as we can research those answers and respond to everybody. So I will turn it over, I believe, to Colin first to introduce himself.
Great. Hi, everybody. My name is Colin Stemper. I'm the supervisor of the Disability Services Fiscal Policy team, and I really appreciate the opportunity to be with you all today. And I will pass it along to Megan Lindblom.
Hey everybody, my name is Megan Lindblom. I'm the Program Integrity Supervisor here at the Disability Services Division. It's good to see you all today. It looks like I'm passing it on to Jan Buck.
Hi, I'm Jan Buck, Fiscal Policy Lead.
And hi, I'm Charlotte Scullin. You'll see Fiscal Policy Lead, and we will explain that further in a moment.
Hi, everyone. My name is Dylan Adams. I am now the Compliance and Data Lead for the Program Integrity team under Megan Lindblom. Michael.
Hi, everyone. Oops, let me turn on my camera. Sorry. Hi, everyone. This is Michael Tao. I'm the Fiscal Policy Data Analyst under Colin. Thank you.
Great, thank you, everybody. And so along with these introductions today, like this slide alludes to, we are having some change in staffing at DHS in our area. So many of you have worked with Jan Buck during her time with DHS, and many of you in her time at Anoka County working on rates. Before she came to DHS, and Jan is actually retiring at the end of this week. So we just wanted to call that out, say thank you to Jan for her years of working on rates and waivers in Minnesota, and just, say a big thank you to Jan. Also, as this slide notes, Charla Scullin, who just introduced herself, will be moving, or is moved into Jan's position and will be taking over her work. So we also are looking forward to working with Charla in the years to come. As with any change, things change a little bit. And one thing that we're currently working on is completing a lot of rate exceptions backlogs. So we're working on backfilling some positions to support that work. So processing times may take a little bit longer in the next couple weeks than you've been used to over the previous couple of years. No need to reach out and ask if we received it. If it's taking a few days to get back to you, that's just, we're working with the staffing that we have at the moment, and we'll be scaling back up in the coming weeks and months. So thank you for your understanding and appreciation as we work through that backlog. And I'm seeing a bunch of thank yous to Jan in the chat. And we really appreciate Jan's time with us. Thank you, Jan, and best of luck in retirement. So with that, we'll move on to our next slide, and I'll hand it off to Michael to talk about some January 2024 rate changes. Off to you, Michael.
All right, thank you, Colin. Hi, everyone. So yes, I wanted to talk about the BLS and CPI updates for January 2024. BLS is just the Bureau of Labor Statistics, and CPI is just the Consumer Price Index. Next slide. All right, so just a big overview of what I'm going to be discussing is we're going to talk about the methodology, the median wage, and framework values, bucket level SOC codes, median wages, and then the framework values. These will be like the your weighted values plus the competitive workforce. Sorry, the 6.7 competitive workforce included. And then we'll be diving into the CPI updates and the methodology around that, percent increase in components and values. Next slide. Okay, so for the BLS wage data, so the statute detects that DHS used BSL data published in March of 2022. And the data that's published March of 22 is May 2021 data. And that data will be used to update the BLS and CPI data for January 1st, 2024. Next slide, please. So I wanted to share this because the current data that we were using is the 2019 data. So in 2019, the clinical counseling and school psychologists, there was a SOC code change in 2021 data. So the SOC code did change, and also the label for that classification change as well. It is now going to be clinical and counseling psychologists. So just wanted to share that little detail with you. Next slide, please. All right, so just an overview of SOC changes impacting in 2024 update. So for January 2024 rate implementation, we found that rehabilitation counselor SOC has the highest increase in medium wage, followed by clinical and counseling psychologist SOC. We also found that codes that stay the same have increased and decreased, ranging from -1% to 22%. And those, the one with the slightly decrease is the substance abuse, behavioral disorder, and mental health counselor SOC. For the analyst direct care, that was a -1% decrease. So if we're looking at dollar amount, it would be 31 cents. And that I will show you the values for that later on the slides. And another decrease is the licensed practical and licensed vocational nurse minimum wage. There was this decrease in 0.43%, which is a 10% decrease in dollar amount. The remaining SOC codes are higher medium wage than the current implementation, ranging from 1% to 22%. Next slide, please. All right, so in the next several slides, you will see minimum wages for Minnesota SOC codes that apply to our DWRS frameworks. These wages are not the framework values. To get the framework values, the wages are weighted in different combinations by services. Please note that these median wages do not include that 6.7 competitive workforce factor, and the weight values are dictated in the statute. Some are more complex than others, with residential being like the most complex, particularly for direct care staff. And a couple more notes here is DHS will publish frameworks values for January release in October, and we will publish the update frameworks once we have received federal approval for the change BLS and CPI date change. Next slide, please. All right, so just jumping into these values. So for residential minimum wages, for the SOC title of Social and Human Services Assistance, you'll note that you'll see that at the very last column, there's a 10% increase for that medium wage. And then for nursing assistants, for the component of direct care base hourly wage, 5% increase. Home health and personal care aides, 4% increase. Psychiatric technicians, 3% increase. Next slide, please. All right, so for community and social service specialists, all other, and this is the supervisor wage component, you'll see that there's an 8% increase. Registered nurses, the RN wage, that you'll see that 1% increase for that. And then licensed practical and licensed vocational nurse, that negative 0.43% decrease. Next slide, please. For adult day median wages, nursing assistants increased 5%. For direct care, home health and personal care aides for direct care, 4%. And then the supervisor wage for community and social services special RN wage and the LPN wage, it's the same percentage as the previous slides. So 8%, 1%, and negative 0.43%. Next slide, please. For day median wages, social and human services assistants, 10% increase. In direct care, nursing assistant, 5% increase in direct care. Psychiatric technician, 3% increase in direct care. And then again, with the supervisor wage, RN wage, and LPN wage components for these SOC titles, you'll notice that it's 8%, 1%, and negative 0.43% decrease. All right, so jumping into positive supports medium wages. So substance abuse, behavior disorder, and mental health counselor. The analyst direct care, here's where you'll see that negative 1% decrease. And the reason why there is that decrease is because the wage point for positive support analyst is set using only one BLS code. So it is more successful to swing due to that single code, whereas other frameworks, they use a mix of codes to set that wage component. So it tends to mean that they're more stable. So for going on to the next, clinical counseling and, sorry, I should say psychologist instead of school psychologist, but it is 16%. And then psychiatric technicians, 3%. And then for clinical counseling and psychologists, the supervisor wage for the analyst and specialist, and supervisor wage for the professional, they all have a 16% difference. Next slide, please. Other unit-based median wages. Here you'll see the social and human services assistant direct care at 10% difference, nursing assistants 5%, psychiatric technicians 3%, and home health personal care aides at 4%. And these are all under these frameworks, for example, IHS with family training, night supervision, and IHS with training. Next slide. Thank you. Community and social service specialists, all others. For direct care base hourly wage, there's an 8% increase, and applies to the IHS with family training, IHS with training and employment services. And the second one is the habilitation counselor. This is where you'll notice that 22% increase for employment support framework. And this is for direct care base hourly wage. And then going down to educational guidance and career counselors and advisors, a 3% increase for that for employment development and employment exploration frameworks. Community and social service specialists, all others, there's an 8% increase for that. Next slide, please. All right, so this slide shows you the base hourly wage for each of these frameworks, and these wages are weighted. So the third column, the framework total wage per hour of service, that includes that 6.7 competitive workforce factor. So these are the values for each of these services for residential and day. Next slide, please. And then here again, you'll see the frameworks. So for example, employment services, this is broken out by employment support services staff, employment exploration services staff, employment development services staff, all of the base hourly wage, the weighted wage, and then the 6.7 competitive workforce factor percent applied to it, the values. And these are all unit based. Next slide, please. All right, so jumping into the CPI changes, consumer price index increase is 15.39%. The statute takes that DHSU data by the percent change in the CPIU from the date of the previous update to the data available as of December 31st, 2022. So the data that was used for the current implementation is November 2019 data. So the data available for December 31st, 2022 is December 22 data. CPI increase applies to the following components. They apply to the client program and supports, transportation, residential, and facility cost day services. Next slide, please. So on this slide, you'll see the component, bucket, service, current value, and then January 2024 implementation value. So the 2024 value is that 15.39% difference. So client programming and support, current value is $2,375.48. The new value would be $2,741.07. Transportation without lift, this is just the standard vehicle. For residential services, the current value right now is $1,831.49, and the new value would be $2,113.36. Then transportation with lift for residential, $3,270.51. The new value would be $73.84. And then jumping into client programming and support. So for a day, except adult day, it's jumping to 12.58%. Adult day, 8.98%. Unit base, except night supervision and personal support, 5.7%. Then night supervision and personal support, 2.79%. Next slide, please. All right, so other upcoming rate changes. There are two upcoming rate changes that I wanted to point out. Sleep values for CRF and FRS will be updated for the January rate release. These update annually and are based on the large employment minimum wage. For 2024 minimum wage value, it is $10.85. It went up from $10.33 in 2022. And then also I wanted to point out respite care services provided in a 15-minute unit will be moved from a framework rate to a market rate effective January 1st, 2024. Yeah, so I think that pretty much covers all of the updates for the January 2024 BLS and CPI updates. Any questions?
Excellent. Thank you, Michael. It's a pretty quick presentation, but it's a lot of work
I agree. Yes, it is.
goes into there. So thank you for all that work and for putting this together. So we've got a few questions in the chat, and just a reminder to all of our attendees, if you have a question, if you could put it in the chat, that will make sure we can get to them and get organized. So the first question that we have is, are the social and human services assistants those who do direct care in SOC homes? Michael, I don't know if you want to take that one or you want to toss that one to me.
I'm sorry, Colin, do you mind taking that?
No, not at all. So yeah, so the social and human services assistance is just the name of one of the SOC codes, or what that is. The name of it is standard occupational codes, which is how the Bureau of Labor Statistics at the federal level is kind of organizes different professions. So it's not necessarily that this specific name applies to a specific job in a service in Minnesota. It's just one of the codes or names of the codes that go into some of the data that we have here. I see two questions that are asking, will this PowerPoint be sent out after? Yes, I believe it will be sent to everyone who is registered for this webinar. So we will make sure people get those. And additionally, like Michael said, there will be an e-list that goes out in the next few weeks that also has these values as well. So keep an eye out for that and sign up for our e-lists to get this information in a slightly different format too. And then we just see one note about speaking a little bit louder. We will try to do that through the rest of the presentation. So thank you. And that is all the questions we have at this point. Oh. There we go. We're seeing them. A few more come out. Someone says the PowerPoint was sent out in yesterday's email, so it sounds like that is out there. Thank you for sharing that. And where can we find the qualifications for the positive support framework? So the qualifications for the positive support service, I believe those could be found in the community-based services manual. I'm not quite sure what you're referring to with the qualification of the positive supports framework. But I think if I back up a few slides, let's see if I can do that. There we go. There we go. So there we see the different occupational codes that go into the positive supports framework. And I see in the chat, you've clarified the staff choice has 3 options. So we'll go back to this slide, and there at the bottom of the table, there are the 3 different types of positive supports and what the base hourly wage will be, and then what that wage with the competitive workforce factor applied to it is. I see another question that says, to clarify, these changes still need to be approved by the legislature before going into the frameworks. So these changes have been approved by the legislature in the last session. However, there are some changes here that still need approval from the federal government, specifically the Centers for Medicare and Medicaid Services, CMS. So some of these changes still need approval, but we're on track to get these implemented on a rolling basis for January 1. All right, I'm going to give it one more minute for any more questions to roll in. So you see one question, is there any reason why CMS would not approve these rates? You know, I don't try and forecast what CMS is going to wonder or ask about when it comes to rate changes, but these are all pretty standard types of changes that we've had approved before. So I'm not really worried about them being concerned about what we're proposing here. And then we have a question, why are new rates implemented on a rolling basis? So as many of our lead agency colleagues who are on this webinar will know, you have to enter information into an online system to calculate each DWRS rate, and it's going to be different by person. So that requires quite a bit of work on their part in collecting the information from the service provider as well. So that kind of happens typically as a person's service agreement renews throughout the year. And yeah, that's when that work is typically performed. And that's all the questions we've received. So we'll give it another minute and see if any others come in. All right, well, thank you everyone for submitting a few questions, and thank you, Michael, for your presentation and work to prepare for this. It's like I said, it's a lot of work to get to this point, so thank you so much.
No, thank you, Colin. Appreciate that.
Of course. All right, so next, I think we're going to toss it to Dylan for a 2023 cost reporting update.
All right, thank you very much, Colin, for that introduction. Hi, everyone. My name is Dylan Adams. I'm trying to be better about also describing what I look like as part of these conversations. So I am a blonde, 30-something-year-old man wearing a very professional gray t-shirt today. So with that, I am going to dive into cost reporting, which is what I kind of work in day to day. Could you go to the next slide, please? All right, so our team wanted to give everybody here kind of a summation of what cost reporting has been like so far in 2023. The deadline to submit cost reports was August 31st, so just under a month ago. We had 322 cost reports out of 569 submitted by the deadline. For those who don't feel like having a calculator, that was about 56% compliant by the deadline. And for those who are curious, that's about a doubling of the number or the percentage of compliance by the deadline compared to last year. So there are still a number of cost reports still floating out there. Providers have until December 1st to submit their cost reports without negative consequence. And what that means is DHS will stop payments to providers who do not submit their cost reports in time. So just note that. One kind of interesting thing to cover is that we did have 497 email inquiries this year to our inbox, the cost reporting email address. That's actually gone up to about 500 or a little over 500 now since I made these slides. And also, we are now actually up to 352 cost reports. So about 30 cost reports were submitted after the deadline. So those folks are now in compliance as well. So you might notice that that's not 100% compliance. So we're not a perfect system. So I would also like to call attention to the final bullet point of this slide, which is that we are engaging in a process improvement effort. We are soliciting feedback always. So if you have thoughts on cost reporting, please send them to our email address, which I have forgotten to put into my slides, but I can certainly follow up afterwards and include that. We will be looking into things like trying to find other ways of communicating with providers to let them know, in addition to the email reaching out that we do. That's just like a taste of what we're working on. We're also just kind of engaging in other system improvements as well. Can you go on to the next slide, please? I also wanted to cover something that is new that has begun this year. So this year we are beginning an auditing and data verification process. And what that means is folks who submitted their cost reports back in 2022, they were entered to be randomly selected by DHS auditors to have their cost reports essentially audited. It's really important to call out that these are not like a tax audit. This is not something that could lead to any kind of legal issue, really. What these audits are simply asking providers to show their underlying cost information, their supporting documentation for why they entered data into their cost reports the way that they did. So this is not us coming after your business. This is not us coming after your rates. This is definitely not us coming after you. This is simply just an auditing process. And once again, people are randomly selected. There's no bias in this. This is purely a process for us to kind of ensure the validity of our data that we are requesting from all of the DWRS providers out there. You know, with that being said, we have noticed over the past couple of years of doing this that there are some checks that we probably could do to catch providers who submit questionable data. I think some of our classic examples have been providers who mistakenly enter, for example, like a rate instead of like their total revenue, or a provider who enters like their hourly wage for their employee, but not all the salaries and wages for that employee. So we are engaging in a process to kind of implement some of those automated checks to kind of flag when we suspect that a provider has kind of missed something. We don't have a timeline for when we will fully implement that. You know, it will probably not even be fully implemented next year. So we will keep you all updated on what that process looks like. But we did want to let you know that we are working on these kinds of data verification methods, and the auditing is happening. So what can you do to prepare for an audit? Can you go to the next slide, please? Here are some tips that we have. I will be fully transparent and say that I got these from a quick Google search of what to do for audits. Essentially, we are asking providers to verify their costs, and the number one way that you can verify your costs is to start gathering your documentation, your sources of information for the costs that you have entered. I think in particular, we are looking for providers to definitely keep track of the way that they allocate their costs. So for example, I put in an example on the slide. You know, if you have a staff member who works on a couple different services, or perhaps like a day service and then like a residential service, or PCA, something even outside of DWRS, we're going to ask your organization for an accounting of kind of how individuals split their time and how various costs can apply to DWRS direct service provisions, DWRS administrations, other costs as associated for your business, etc. So we generally just recommend that you have those costs available. Keep your records up to date, and please do not solely rely on your gosh, what is it? Your MPSE or minutes, your record from the state of Minnesota. All businesses are kind of expected to keep track of their costs outside of those systems. And with that, can you go to the next slide? So what else is going on with cost reporting? Well, what's left is we are waiting for the remaining providers who have yet to submit their 2023 cost reports to submit them. They have until November 30th to report those costs with no repercussion to their payments. As of December 1st, we will flag providers who have not submitted their cost reports and do DWRS services, and they will have a stop payment status applied to their business. I will be transparent. We expect that a good chunk of those 225 providers are probably closed by now, and that's the reason why they haven't reached out to us or they haven't let us know. I don't know how many out there are probably closed, but in previous years it's been about 10% of the sample size. So cost reporting, the data that we collect informs what the legislature does in determining rates. This year, we are not required to submit any analyses or reports related to cost reporting data. But if the legislature in their session in 2024 requests anything from us, we will certainly provide data to them. But just know that we're not really working on any analyses that will be publicly available. I have included a link to a report that we did publish, I believe, a couple years ago. That's coming up, so I'll address that in a moment. Other things to know about 2024, or excuse me, the cost reporting in the upcoming months. In 2024, we'll announce the next sample by the end of March. For those providers who are interested in kind of preparing for that, we just recommend that you start gathering your business records. On the next slide, I believe I have included some resources that you could peruse if you'd like. And these slides will be sent out after we're all done. And the final thing to note is just a general reminder for all cost reporting that by submitting a cost report, you are attesting that what you are reporting is as true as you can possibly ascertain. So you are attesting that, to the best of your knowledge, that all these things are as accurate as possible. And with that, can you go to the next slide? So these are the resource links that I mentioned a moment ago. If you are interested in learning more about cost reporting, if you have not yet done it, we encourage you to check out our cost reporting manual and website. Both of those are linked on this slide. And then that report that I mentioned before that showed some of our findings from our first year of cost reporting, that was published in April 2022. That is available and linked right there. And again, we're not doing a formal published report this year or formal analyses of cost reporting data. But if the legislature comes to us and they request information, we will certainly do that research. So with that, I believe, can you go to the next slide? I don't think I have anything else. Yeah. Does anybody have any questions for cost reporting and cost reporting for 2023?
Yeah, so we've received one question in the chat about your portion of the presentation, Dylan. It says, was this random audit part of the process known to happen starting in 2022? And was this part of what the legislature required?
Yes and yes. I assume that was this process known to happen starting in 2022. We have been upfront since I think the very beginning. We've included links to the statutes that apply to cost reporting. An auditing process has been a part of this since the very beginning. We have also been very upfront that that the auditing is not like an attack on your business. It's not us trying to have like a gotcha moment. It's really purely just to verify your costs for the cost reporting. Ken asked, is anything submitted to the legislature public? I think it could be. I might defer to my supervisor on that one. But generally, if we draft up something, it could be made public. I am not super knowledgeable of the nuances of that, but I assume so. We're not allowed to publish anything about an individual provider's records or data. Any information that we provide publicly has to be aggregated or obscured in some sort of way to protect the privacy of companies. And that, I believe, is also in statute. Are there any other questions?
I'll say, this is Megan. To Ken's question about the legislature, we get ad hoc requests from different legislators, and we aren't necessarily publishing that information, but again, it's all aggregated data that we have provided. Anything else that we'd be providing to the legislature, like the legislative report that's due every 4 years, that is posted at public online, as all legislative reports are.
There doesn't seem to be any other questions coming in. So I want to just say thank you, everyone, and thank you to the providers who submitted their cost reports this year. Thank you, everyone who's been a part of the process to improve it, who have given us feedback, who have asked us questions. This is still very new and we're still fine tuning it, but we really hope that this can be a successful program that can continue to inform the legislature and create, a functioning, equitable, efficient system for paying rates to providers. So with that, I am going to hand off the presentation to my supervisor, Megan Lindblom.
Sorry, thank you, Dylan. Talking on mute there. I am going to do just a little bit of an overview of a new statute that was passed in 2023, and ask for a little bit of feedback from you all, which you will have an opportunity to put in the chat. So if we go to the next slide, please. So the new requirement is what we refer to as the compensation threshold. And what is that? It is a requirement that a minimum portion of the DWRS revenues that are paid to a provider should be passed on as compensation to direct care staff. The amount of the revenues is different by service bucket, and we'll get into what that looks like in the next slide, but it aligns with the rate framework assumptions. So if you have a larger portion of your rate that is assumed to go to direct care staffing, then you would see a larger portion of revenues that would also be assumed to be part of compensation here. Compensation, and I'm using that word a lot here, it's not just wages, and I think we've heard this colloquially be referred to as, a wage threshold, but really it encompasses more than the wage. It is also any cost to the employer, such as benefit, taxes, or other things of monetary value, and in a couple of slides we'll talk about the list that's actually outlined in statute of what that includes. And I'll note that this requirement is effective January 1st of 2025. So this isn't something that we'll see for next January, but there is compliance and there is monitoring that is required by statute. So this is something that you should have in place come January of 2025 within your payment and bookkeeping. Next slide, please. So, and this is a little bit small, I apologize, but I wanted to get each one of these in. But like I said, the percent of revenues does vary by bucket. So a provider who is paid with rates determined under subdivision 6 in the section of statute that is DWRS, which is 256B4914. This is mostly residential here. has a minimum percent of 66% of revenues generated by the rates under that section. For day services, which is subdivision 7, that is a percentage of 45%, and rates determined under subdivisions 8 and 9, which are all unit-based services under DWRS, is a minimum of 60%. And if you take a look at this and do kind of the backwards math here, I want to say like this is a variation between 5 and 10% of the assumed compensation that would be happening under those frameworks, and therefore ties out pretty standard. And you can see how there's variation between the buckets. And again, just to call out, this isn't something that is tomorrow, but this is a little over a year out before it is a required practice. Next slide, please. So to talk a little bit about what's included, and you will see these really align with frameworks as well, are the things that are called out within the frameworks that are seen as compensation. So number 1, of course, is wages, and this is for all direct care provided through these services. Taxes and worker compensation costs for the employer, and the rest of these two come with the caveat of for the employer. Health insurance costs are the costs for the employer, not the costs that are paid by the direct care workers, for example. That includes dental, vision insurance, life insurance, short-term disability, long-term retirement spending, tuition reimbursement, wellness programs, paid vacation time, not accrued vacation time, but paid vacation time or sick time, and other items of monetary values provided to direct care staff. So understanding with that item 14 that this list is not exhaustive and that may require us to consider things that are not listed here, but that's a future conversation. Though as we get to the end of this portion, we are asking for any guidance or thoughts that you would like to share with us. So if you have additional things you're thinking about, I'm more than happy to hear. Next slide, please. Perfect. Next steps, like I said, this is something that is starting in 2025. I don't know about you, but sitting in 23, that still feels pretty far away, but we know it'll be here before we know it. Compliance will be determined through DWRS cost reporting, beginning with the 2026 reporting year. So again, everything with cost reporting is kind of a year lag. So if you're required to do it in 25, we're going to be looking at data starting in 26. So that's just kind of a marker for everybody to understand. And that actually 26 will be the first year of the second reporting cycle. So everyone will be back in the hopper at that point, and may be called to cost report anytime between 26 and 31. Development of the compliance analysis is yet to be determined. We're still looking at that. Development of the compliance reporting is yet to be determined. We do anticipate the cost reporting is the vehicle there, but how we do that and how we develop that is still in the hopper. And then we ask, and I know Colin has kind of already said this around other items, but I'll repeat it here. Keep an eye on e-lists and the DWRS quarterly webinars like today for more information as it becomes available. Though again, because we are pretty far out on this timeline, we anticipate that firm guidance and updates may not be available until a ways into 2024. Next slide, please. So as a part of this development, we kind of wanted to take some time for you all to ask questions, provide comment or clarifications that would be helpful to know. I don't think I can answer all of your questions yet because like I said, it hasn't been developed, but if you want to drop any feedback or ideas in the chat, feel free. Also, if you want to kind of gather your thoughts and send them in via email is completely fine as well. So with that, I'll give a little bit of space, and I do see a couple of questions, so I can get started on those to help us out here. First question that I see is from Mark, and it says direct care compensation. Are the current percentages known on how much is given currently? This is something that varies pretty greatly in our analysis from cost reporting data overall. There is no standard requirement at the moment that I'm aware of for DWRS providers. So that is looking at kind of, it's going to be, for some people, this is going to be a big lift. For other agencies, this may actually be something you're already doing. So it does behoove us all to take a look at kind of how that spending breakdown happens in your business today. Ken asked, how will the thresholds determined? They're already causing some angst among the providers in our membership. I have also heard that from multiple providers, not just from our representative providers as well. These really are, and I talked about it a little bit, but they were determined based on the assumed compensation percentages out of the DWRS frameworks themselves. So if you're looking at kind of the frameworks and looking at all of the different cost centers that are within each framework, we look at that as a percentage of the spending that we would see coming out of that rate. So wages, all of the benefits and payroll taxes are included there, so on and so forth. So that is how that was determined to begin with. But again, we're willing to look at feedback and thoughts. And then of course, the percentages were then lowered below that to assume that not everyone is spending in the same way. Sorry, I'm reading questions and catching up here. So I'm going to read Brenda's question, see if I can't pick it up as I say it here, but the compensation threshold needs to be in effect by January 1st, 2025. But like previous DWRS or CWF had dates we go back to, like if we're implemented changes earlier. Example, in 2023, we could go back a few months to include those changes to support the compensation changes in compliance with rate changes. So Brenda, I'm not 100% understanding the question. So if you want to provide further clarification, that'd be helpful. Or if any of my DHS partners are understanding this and would like to support me here, I'd appreciate it. I see. I'm going to move on and we'll circle back to that one there. Is unemployment insurance considered a cost under the compensation of employees? Unemployment insurance would be part of the payroll taxes and costs. So at this time, I do anticipate that that's included because it's obviously the UI values here in Minnesota are based off of hours worked for the organization. So that should be something that's included. But again, we'd have to take a look at that specifically, but it's a clarification we can make in our policy. The question about other monetary, does that include hiring incentive, bonuses given, events? Yes, that can include overall kind of like if additional pay is given, if they are provided free childcare, that's something that we could consider. But again, we want to make sure that the rules are really clear here. And again, that those are clearly reported and denoted in cost reports. So that'll be something we have to work on together as well. Okay, I'm just looking here quick and catching up. I see Brandon asks, are the amounts based on percent of total? Oh, we're scrolling quick here. Year-end revenues received in a bucket, or will we need to try to figure something out based on all separate component values? This is something we haven't determined yet. I would say, you know, from my perspective, if we're using cost reporting, we would be looking at it at an aggregated annual level. But again, that really would look at how you're breaking out your costs and reporting your costs for direct care as well as other costs within your cost report, which we know has been something that we've provided a lot of technical assistance on as well of how to allocate an employee's time. Sorry, I'm catching up here, and Ken and Brenda are helping me out. So give me one moment. I apologize for the silence. So I apologize to Ken and Brenda. I'm not 100% sure what we're getting at as far as compliance. I would always encourage compensation to be set at these thresholds as soon as possible, that is financially and procedurally possible for your organization. But we will be looking at costs overall that are reported as far as we understand it today. let's have a little bit more conversation. And again, Ken or Brenda, if you want to send something via email that we can kind of consider as we look at the development here, and we'll earmark that for future conversations. And I apologize for not fully understanding the reference you're making.
So Megan, this is Colin. I think they're referring to, you may remember, with our rate increases back in 2022, there was a statutory requirement to use 80% of that increase for direct care worker compensation. And at that time, because of rolling increases in rates, the guidance was a little bit flexible on how that 80% was determined and how compliance with that amount was determined. So I think that's just what they're referencing in their question.
Okay, that helps me a little bit. Thank you, Colin. And I think we really wouldn't see a look back here because this isn't tied to a rate change. This is a new compliance threshold. And I would, and Colin, please correct me if I'm wrong, I don't think we have January 25 increases either for DWRS. Is that correct? As of right now?
You are incorrect. We have another BLS and CPI increase that year.
Okay, that is good to know. And I think that'll be something we have to take into consideration as well. However, you know, really what we're going to always go back to is the revenues that are reported and the percentage of spending that goes towards the compensation of direct care workers. So whether or not you made $1 or you made $100 or $1 million, the rate itself should hold out for that overall across the year. So again, it's something I think we can take into consideration and look at a little bit further, but at first blush, I don't see this being something we would look retroactively at. Yes, thank you, Brenda. I saw an additional question from Suzanne. Our new legislative requirements figured into the increases. Example, sick and safe time will have a financial impact. Where are these mandates captured? Colin, can you speak to this one at all? I guess I'm a little bit unclear as to the question here as well. So I apologize, guys.
Yeah, when it comes to rate increases, you know, with our rate formulas are in statutes. That means that if there are increases or other changes in rates, the legislature has to actively change the law to factor in those additional costs. So unfortunately, there isn't necessarily an automatic mechanism where perhaps some costs increase related to paid time off, for instance, that is necessarily captured right away or automatically in the rate formulas. That being said, and reel me back in if I'm off on this, Megan, but when it comes to perhaps these compensation thresholds that we're talking about at the moment, costs that you would have related to those changes in law that may impact benefits employees and service providers receive, those costs would likely be covered in meeting these types of requirements. So I think that's perhaps both sides of that issue too.
Thank you. And you're correct, Colin. Like I had called out a couple slides ago, sick time, paid time off, or vacation time that's paid out to the individual would be something we would consider as compensation because it is part of their compensation package to have access to that paid time off. So that is funding that is going from the employer to the employee. Therefore, it would be included. Thank you for helping clarify that one for me, Colin. I see one more question, and this is more, I think, a comment from Linda about the potential for unmuting. I think we're seeing that, and, you know, bear with us as we kind of figure out this new world order and how to have these conversations. So yes, we understand that the ability to unmute would have been helpful here. So thank you for the feedback. And I guess I'll give it a couple more minutes to see if there's any other questions or comments. And like I said, if you do want to reach out feel free to shoot me an email with any of that background or any of our DSD emails, and they can get them to me. Yeah, and I think I'm unsure of who I'm passing on to. Is it you, Colin?
Yes, I believe so. So thank you, Megan. So like Megan was just referencing, we are on kind of our third webinar in this series. And this webinar series kind of evolved out of what was previously called the DWRS Advisory Committee, which we talked a little bit about at our first webinar this year. So as we kind of made this transition, we had some ideas about topics that we wanted to cover in the first few webinars that we held. And now we have one more scheduled for this year coming up in December, and then we'll begin doing other webinars on DWRS in 2024 as well. But we also thought this would be a good point in time to collect some feedback from people attending these webinars about what topics may be helpful to cover in future webinars. And, you know, it's kind of, we can do different things with these webinars. We can kind of do some information sharing like we did today. We can do some more training and do some more targeted outreach to different folks as well about perhaps not necessarily new topics, but just training folks up on topics that have been around for a while, but maybe we have new folks doing the work, and it would be helpful to recover topics that have existed for a while. So really what we wanted to do with this slides before we wrap up for today was just to have people put any ideas in the chat about topics that would be helpful to cover in future DWRS quarterly webinars. So we just put kind of two prompting questions here. We don't necessarily have to stick with these two, but kind of those two questions we had are, what do you want to learn more about related to DWRS? And then are there specific training topics that would benefit a broad audience to cover in this type of forum? So if anyone could put some ideas in the chat, I'll read those out as we get them, and you may help inform some future webinars that we plan and schedule here. All right, so let's see, getting a few in the chat here. So it says you track and report on rate exceptions. Do you have a way to track the most common topics for which you receive general DWRS questions as a guide? Yeah, we could definitely look at rate exceptions in the future. And I see another person wrote in, noted that as well. Someone else wrote, I think it would be great to learn more about the component values and the rate setting for customized living. That's a great idea. Customized living works a little bit differently than some of the other DWRS frameworks that we covered today. Let's see. Someone notes how to capture unbillable time in IHS, that's individualized home supports, so it can be used in a productive manner in cost reporting. Then I'm seeing rate sheets and providers. It seems to be getting worse with rate requests, not looking at needs identified in mid-choices assessments. So that could be something about looking at how to connect assessed needs identified in assessments, and perhaps support planning and identifying those hours within frameworks. I'm seeing continued refreshers on entering data in DWRS. Someone says, I would like to go through rate exceptions and discuss areas for reimbursements. Some more rate exception topics. Then how will the new MinChoice's assessment information impact the frameworks? And we will definitely capture all of these before we log off the meeting today. So thank you for putting that in there. Someone else writes, I think it would be helpful to also discuss issues with MinChoice's assessments and identified needs compared to unidentified needs that we are still expected to meet as a provider with these services. Thank you. Someone writes, why are rates based on the capacity of the home versus the number of people actually in the home? So that's kind of talking about residential rate setting and some of those shared staffing business rules. So that could be a good refresher too. Thank you. All right, I'm going to pause for a minute to see if anyone has anything else that they want to put in the chat. I'm seeing my previous comment was suggesting you track the reasons for DWRS related questions similar to how you track rate exception requests. So you get an idea of the topics that come up most often. Yes, definitely about technical assistance we may provide and areas of misunderstanding that we encounter most often. I'm seeing understanding the business rules or when a rate exception is not approved and why that might happen. Then I'm seeing as homes are taking in fewer people due to rates for more, meaning the rate they get are less. Will the frameworks then possibly look at this? So I think that's kind of getting at rate sufficiency and covering the costs that providers incur, which I think is definitely a piece or intent of cost reporting as well. So that will be something that we keep looking at. Other ideas, if you want to write them in the chat. All right, and clarification on that last one, meaning if you have 4 beds, you may earn more by only having 3 beds to cover your costs. So yeah, kind of getting back to some of those business rules. Yes, and someone notes that it's clear the need for rates and exceptions to be discussed, clarified, explained for both lead agencies and providers is what is needed. Yeah, I think that is clear from the suggestions that we're getting here in the chat. And I think this is kind of a great opportunity to review policies and do some training with both lead agencies and providers in a single venue. So I agree with where that's going as well. And then reviewing ICS rate setting could be helpful. Yep, and got a ditto on that. So that would be great. That was kind of on our list of things to potentially cover in the future. So we're right in line there. Then we see, can we discuss why some counties require their own exception form, and we'll take a 5820, so getting back to exceptions again. All right. Give it maybe one more minute to see if we get any other pieces of feedback. All right, I'm not seeing any more come in, but if you have any more ideas, feel free to put those in the chat. We're taking them down and documenting them so we can put them on agendas for future webinars. So with that, that brings us to the end of our slides for today. So I want to thank everyone for joining our webinar and want to thank all the DHS staff that presented today. Yeah, really appreciate all the feedback for future meetings as well. So thank you for joining us today. And as Megan was mentioning earlier in the meeting, if you have thoughts or questions related to the content, don't hesitate to reach out via email or by using the DSD contact form to get in touch with us. And just saw a question about where can we find this recording. So earlier in the chat, I think it was at 1:28 p.m., there was a link added to the DSD training archive. So this will be in that archive. That's also where you can download a copy of this PowerPoint as well for your own records. So with that, I'll thank everybody for joining us today. Okay, chat only goes back to 1:58. So Anna, would you mind putting the link? There we go, perfect. So the link was just added to the chat for anyone who needs it. So yeah, thank you all for attending today. We appreciate you joining us, and we will connect with you again in this venue in December. So thank you so much and have a great afternoon.